Dr. Kristen Simpson is in with us now to talk about good dental health, and it's good to see you today.
Thanks.
Thanks
Great
for
to be
stopping
here.
by.
Yes.
We do have a couple questions that
sure.
we can field from some viewers, and we have Leslie from Sissonville who's written with the question. I switched dentists, Leslie says, and my new dentist says I have cavities, which is that the other one 6 months ago didn't have trouble then.
Right.
Is that possible?
That is possible, and the reason why that can happen is a lot of times with the advances in technology, we have ways to be able to catch these cavities earlier, and one of the ways that we can do that is with a laser cavity detector. The laser cavity detector just shines into the grooves of the teeth and it'll let us pick up areas of decay before we can see it on an x-ray. So it could have been that your other dentist was only using the x-rays and didn't have a laser cavity detector to be able to get these cavities in the grooves early. So once you catch them early, you're able to fill in those grooves to be able to seal those grooves. So this is what the laser cavity detector looks like, and it just gives us readings of how much of the decay is in the tooth. And this is a groove of a back tooth, your back chewing teeth. They just have deeper grooves, and you can see that there's actually a cavity starting in this groove. So what we can do is just clean out that groove, put in a filling material. It makes it a smoother surface so that it's easier to keep clean and prevents that cavity from developing even more. So it's good, you know, to catch things early. We always talk about that, and we want to be able to get the cavity while it's still in the enamel of the tooth before it progresses into the dentin, which is the softer tooth structure, and then the cavity goes faster then.
So overall, technology has just made the detection even more.
That's right.
More possible.
Yes.
All right, we have Brandon from Bell who had asked a question. My gums bleed, Brandon says. Well, I floss. Is it normal?
Well, no, that's not normal. If your gums are bleeding when you're brushing or flossing, that means you have gingivitis, which is the start of gum disease. So, to be able to prevent gum disease, what we want to do is make sure that you're brushing and flossing, at least, you know, flossing at night before bed, brushing, you should 3 times a day, but if you can't, you know, you can chew the sugarless gums in between, and then eating healthy snacks, not sipping on drinks throughout the day. That's one thing that you can do. And this picture shows what a healthy gum and bone structure looks like on one side, and then it shows the buildup of tartar on the other side and how the bone starts to shrink away with that constant irritation and inflammation. So what you want to do is keep the gums healthy. So here's a picture of healthy gums. They're pink and they're stippled, kind of like an orange peel. So that's what healthy gums should look like. If they start to look red and inflamed, that means that you're not cleaning as well as you should right along the gum line, because that's the most important area to get, is right along those gum lines.
Can you damage the gum around the gum line too if you're doing things too hard?
Yeah, I mean, you want to make sure you have a soft bristled toothbrush.
Because I see that all the time, you know, in the toothbrush aisle. They're not all soft bristled.
That's right. They do have some harder bristle brushes, but you want to say with the soft ones, and just kind of gentle pressure is all you need to get rid of that plaque buildup. It's just a real soft substance.
So don't be stressed out and just like brush as hard as you can, right?
Yes.
Do some
And the
damage
powered brushes are great too, because they'll often turn off if you're pushing too hard on them.
Very good to know. All right, well, Dr. Simpson, thanks a lot for coming in. We appreciate your advice. WVSmiles.com, always a place to start out if you have some questions too. We're back with more for you right after this. Don't go away. Simpson is in with us now to talk our good dental health, and you know what? It starts when you're very young.
That's right, it does.
Learning all of that.
Exactly, and February is actually Dental Health Month, so this is the time when we try to educate the kids on how to properly take care of their teeth. Actually, Friday was Give Kids a Smile Day, where we were able to treat some kids that aren't able to seek dental care. So that was a great opportunity to get involved early with these kids, because you know, once they learn those habits early, they can maintain them for a lifetime.
How many patients did you see?
We saw about 70 patients or so.
That sounds like a lot.
So yeah, it's a great opportunity to help those kids and to hopefully get them on the right track. So since it is Dental Health Month, we just want to go over some teeth tips for how to educate parents and kids. And one thing that they might want to know is that the kids will have 20 baby teeth. They'll come in by the time they're about 2.5 or 3. They'll have all of those 20 teeth. There's 10 on the top, 10 on the bottom. And then around 6 is when they'll start getting their permanent teeth, and they'll get their 6-year molars first. And then around 7 or 8 is when they'll start losing those front teeth. And then about 11 or 12 is when they'll get these premolar teeth. And then, of course, around 18 or so is when they get wisdom teeth. So you want to make sure that you're telling your kids to stay away from those sugary foods, not to have those sweet snacks, to have, you know, the fruits or vegetables.
Always the gooey things, too, get you in trouble, don't they?
Yes, they get stuck in the teeth, and then that's what causes the cavities later. And especially with drinks, you don't want to sip on pop or soda throughout the day, because that sugar can break down the enamel and can make your teeth more susceptible to developing those cavities. So you just want to make sure that you're teaching your kids how to properly brush or floss, and make sure that you're checking them after they do it. A lot of times, even if the kids seem very independent, you might think they're doing it well themselves, and they might not be. So
I still watch.
Yes.
We get good reports, but I still supervising.
Just to make sure, yes. I mean, even up to like 7, 8, you want to do that. Yeah.
And beyond.
And beyond, yes,
hurt.
exactly.
You're still the boss, right?
That's right.
All right, do you like the rinses, too, for kids?
Those are good,
Okay.
yes. That can help to freshen your breath, and it's still important, though, to make sure they are brushing and flossing, too. Yeah.
All right, and those little flossers make it easy for them.
They do, so they don't have to worry about wrapping it around their fingers. They can just use that to hold the floss for them, and that can help a lot.
And I think more now than ever, if there's a kid who's, you know, anti-brushing teeth, there are just so many little characters on the brushes and everything.
Exactly. So many novelties to help them just be excited about the whole thing. Yes.
More than ever.
Yes.
All right, we do have a question for you, too.
Okay, sure.
Sherry from Oak Hill had written in, is it normal to be able to tell if a tooth has a crown? Can you tell?
Well, you shouldn't be able to tell, but a lot of times with front teeth and crowns, you can often see a difference in coloration, or maybe if some older crowns had the metal underneath, you might be able to see some grayness around the gum line, and this is something that you shouldn't see on these crowns on the front teeth. So at Simpson Dental Associates, we have our own in-office lab where our lab technicians are able to make these crowns to match teeth so that you can't tell that a tooth has a crown, and that's actually the best type of outcome to have for when you need to have something done, especially on a front tooth. So a lot of times if you have discoloration around the margins of an old crown, we can replace that and make it match to the point where you can't tell that it's there, and replace that beautiful smile. So that's something that we can do with the in-office lab, because it's really an art, you know, building that porcelain and getting everything to match. So it really helps to have the lab right there to do that with us.
And when in doubt, if you have any questions, always wvsmiles.com.
That's right.
Place to go. All right, Dr. Simpson, it's good to see you this week.
All right.
We'll see you next time, too. And we're back with more for you right after this. Don't go away.